Hey Vino, okay, I'm going to give you some uh, concepts and some techniques to do. I would say the concepts are more important than the techniques because really the art form of this is following the principles of the feeling of the tissue and how it works. And the techniques are kind of starting points for you where you can work from, but it really depends on what's going on in that person's body, what you feel and how their body is presenting. You were saying that his body is leaning to the right. I kind of imagine something like this from what you said, maybe a little bit going forward, maybe his head's forward, maybe his shoulders are forward and he's compressing, something like this. So all that stuff is causing pressure on his organs, his heart, his liver. You said he's got some congestive heart failure type symptoms going on with edema and swelling. So lifting him up out of that, opening his shoulders, bringing his head back, opening his chest, taking the pressure off the ribs in this whole area is going to make a big difference in how his organs are functioning. So that'll help. So fascia, I'm going to tell a little bit about fascia. It's like a three-dimensional web, like a spider web. And so if you put a pull onto a web, you see how my shirt is moving, how my body is kind of going with that. That's really how fascia works inside our body from head to toe. Every system, every cell of the body is surrounded by sheaths of fascia, and it's got this webbing effect. Things slide and glide, but they also interconnect. And so you don't need to know that much about it, but if you just think about it as you're working with his body from that perspective, it'll help a lot. So part of fascia is elastin, which, like, if you stretch your skin and it snaps back, that's the elastin snapping back. At the end of that point of that stretch, anywhere in the body where you stretch things, you're at the end of the elastin, the elastic component of fascia, and you're at what's called the collagenous barrier. Collagen and elastin work together. Elastin is more stretchy, collagen is more dense. It takes more time to affect it. That way it keeps us from getting hurt really easily. We don't transform very easily. It takes a lot to affect us, where we just change our shape. So collagen it takes more time, and that's why it's important when you do these techniques that you take time to. It takes about a minute and a half. Like a lot of traditional physical therapists and other therapies, they will just stretch something for like 20-30 seconds. What I'm going to suggest is that you do each stretch for about 5 minutes or more, or each technique. And it takes a minimum of a minute and a half to 2 minutes for the collagen to start releasing on average. And then you want to have multiple releases. So that's one thing. Think about it like an analogy would be like when you work with a dance partner. This really helps me a lot. You've got this kind of dance going on where you conform to each other and you're pressing into each other. And that's really when you're doing therapy on someone, this kind of therapy, working with fascia. I call it connective therapy. I use myofascial release mostly, but craniosacral therapy and visceral manipulation and muscle energy techniques, those things also. But anyway, when you're working with fascia like this, I always start at nothing, no pressure at all. And then just like working with a partner, then you can kind of start to listen. But if you're like already in there with a lot of pressure, with a lot of force, and you're trying to make something happen, you can't hear, by listening through your senses, what the body is trying to do. Because a lot of times if his body's doing this, he's got this pattern going on. Think about a fly caught in a spider web and the whole web's pulling toward that fly. If you try to just force him open, his body might resist against that. And sounds like what you were doing is helpful. That is a good technique to try and lift him this way. And you said you were doing it gently, that's great. And to do it slowly and for a long period of time, like I said. Another thing you can do is called indirect. It's a very effective technique. If you think about, you can apply this to anything in the body, anywhere where his body is not moving well, and you can do this on yourself. And this works physically, it also works with the mind. If you think about something that's got a tension to it or resistance to it, think about a stuck jar. If you're trying to open a stuck jar and it won't open, close it, then open it. Go in the direction of ease first, makes it easier to go the other way. a dance teacher that I used to work with, one of the things she used to tell me is make movement 1 so big that it becomes movement 2. So if you take the tension he's got going on and you exaggerate, so he's going this way, not with force, but gently take him that way more. And that will really help with, you think about his martial arts stuff you told me about. Work with that, use that in your favor. If he's trying to resist against you, you're trying to pull him out of it, and he's going, no, and it sounds like you probably already have a good sense for this, and maybe you're already doing a lot of these things I'm saying, but if you connect into where he's bending the most, wherever that spot is, it might be here, it might be here, but I'm kind of guessing it's somewhere around here, and he's kind of pulling into that, and you just get on either side, and you encourage him to go the way he's going, but you just connect at nothing, no pressure, and just, where does his body want to go? And you just take it that way. If you think about a stuck fist, and if I try to force a fist open, it's really a battle I almost can't win. But instead, if I just connect with the fist and say, what's this fist doing? How can I help it to soften? How can I help it to relax? And you go with it. Eventually what happens is it just starts to unravel. And so that's the idea that we want to do with this, is help him, but be with it, be slow with it. The more relaxed you are, the more comfortable you are when you do it, the more effective it's going to be. So that's a great technique, is going with it, the way he's going, and take him further into it. If he seems uncomfortable, never force anything, but just test the waters with ranges of motion. Probably after you go this way for 5 minutes or so, it's going to be a lot easier to go this way, the way that we think we want it. That it probably should go. So that's a very effective concept you can use with any part of the body that's stuck. Go the direction of ease. Oftentimes I do that first. Let's see. I touched a lot of the things I wanted to say. I want to give you a couple techniques. One other principle. It's going proximal to distal. Proximal means toward the center of the body. Distal means toward the outer parts of the body. It's a good overall principle to follow. If he's got issues here, or if he's got issues, wherever someone's got issues, oftentimes it's more effective if you start in the center of the body and work your way outward. Because a lot of times there's tension in here, excess tension in toward the middle of the body, that's making things on the outer parts of the body dysfunction, that's pulling things in. So I'm going to give you 3 techniques that will help with some of the things you told me about. That will help with drainage from the head. It'll help with drainage here and opening up the space here. I'm going to give you 3 techniques. They're very simple. They're all called transverse techniques. Transverse meaning from the front of the body to the back of the body. So from here to here, basically, or here to here. So I'm going to give them to you. It's going to be pelvis, respiratory, the pelvic floor, respiratory diaphragm, thoracic outlet. We're going to start with the pelvic floor. So I'm going to put one hand on the sacrum. That's this part right here of the lower back, and where the hip bones and the spine come together. Okay, so I'm going to put one hand on the sacrum while he's laying there, or you could do it while the way he's sitting up, whatever is most comfortable. And then I'm going to put the other hand just at the edge of his pubic symphysis, just above the genital area where that bone is right here. You're going to put one hand, the lateral part of your hand there, and just connect. Do nothing at first. You're going to just connect there and do no pressure, and be at the point of nothing where you don't feel anything. And then you're going to press in until you eventually feel like a water balloon, like you're pressing into a water balloon, and you feel connection on both sides. You don't want to be too much, and you don't want to be too little. You want to be just where you feel a connection. That point is exactly the point you want to be. This is the feeling of connection from that 2 hands. Then you're going to follow the tissue 3-dimensionally. It's going to be subtle, but this actually can help him with his digestion, with his urination, lower back issues, a lot of different things. Do this technique for about 5 minutes. And then you'll just get a sense when you're done. Then we're going to do another technique at the respiratory diaphragm. That was the pelvic floor. We're going to do respiratory diaphragm. Go to that soft spot right beneath your sternum. There's a little soft spot right where the ribs come together. Put your palm right there in that soft spot in between the ribs. And then the other hand is going to go on the opposite side on the upper back. And we're going to be about right here. So we're going to do the same technique, compressed, start at nothing, do nothing. Compress till you feel some connection. You're making that water balloon start to move, back off, just to stay at that point of connection. As it slowly releases, just follow it three-dimensionally. Monitor your pressure as you go, just like if you would working with a dance partner. Third one we're going to do is thoracic outlet. Go to your collarbone, his collarbones. Your hand's going to go just beneath the collarbones, just like this. There's the collarbone, there's my hand. The other hand's going to go on the other side on the upper back. Just like that. We're going to go like that, do the same principles I did on the other two techniques. I'll give you one more that's great for opening up the cranial base, occipital cranial base, or this is called occipital cranial base or occipital condyle release. We're going to go to where we're at the base of the skull, where the soft tissue and the skull meet. We're going to cradle it like this. This is gently traction. Gently traction and just slightly cup the fingers in. We'll do that for several minutes and then eventually let your ring fingers come to near the middle, just to the side of the middle, and just gently go up and then traction toward you. That's going to help open up. There's this little hole in the head called the foramen magnum, and it can help things to drain from the head, help them think better, help blood flow better, help your sinuses drain better. Just so we're going to traction like that for a little bit. And then after you do that, so both hands do that for several minutes. Then we're going to just cup the skull, put almost like a Spock hold, the cranial base, and then get one hand on top of the chest. Gently connect, compress down, pull the head toward you, lean away a little bit, press down toward the spine, and then down toward the feet. So we've got this action going on. It's great to open up this space and help with his posture. He's probably also really rounded here like this, that's my guess. So anywhere that feels tight, hard, hot, those are areas that are restricted. The skin should move freely in all directions, anywhere in the body. So if it moves like this, see how that tissue's moving? That's free. But if it's like stuck, that's a fascial restriction. If it's hot, hard, if it's stuck, those are restrictions. So that's a way just to test if the tissue is restricted. He's probably stuck right here a lot. So one you can do what's called a cross hands release. Connect, press toward on him. You're going to go press toward his spine and then open. And we're going to use the skin as a lever. We're not going to slide. We're going to sink into the skin and then take the tension out. And it's going to be pulling into that web. So it's going to reach deep inside and be pulling on his muscles, on his fat, on his bones, on his heart, on the layers of fascia around these tissues and organs. So think about what we call extending your touch. Think about just, if I could reach deeper, but it's not a physical forcing thing. It's relax. Just relax and extending your touch, and you're going to follow it three-dimensionally. It's just a great way. Just what's his body doing? Just think of the way you talked about opening him here, opening him here, out and down. So those are a couple very good. Oh, one more. I've given you several, but I'm going to give you one more. A liver lift. I think this would be very helpful because you talked about him being like this, slumping to the right. His liver is being compressed. So I want you to go to the bottom ribs of the right side of ribs. Go a little bit below the ribs. So I've got my index finger on the ribs. My other fingers are going below there. I'm sinking in gently, just not the flat part of my finger, sinking toward the spine. Then I'm cupping underneath, and then I'm going toward. Then I'm lifting. And you're actually, this is a way to get in it as he's leaning forward. So you get behind him, put your weight behind him like this. You sink in, You scoop it under. You press against him, lift the liver, and then you can kind of like go with his body. Which way does it want to go? Work with his martial arts stuff, like I was saying earlier. If he's fighting against you, just which way is the way that helps his body to release and soften? Which way helps his body to soften the most? So that way it takes away the fight in him. If he's trying to fight against going this way, don't fight with him. Just relax and go with him. And that will help his body and his mind to let go of the struggle and just to feel that he's being supported, he's being helped, he's being loved. So that's a couple other things. I'm giving you a lot of stuff, but I figure I will. You could do some tractioning of his heels. Lift his heels up if he's laying down. Lift his heels up and just gently lean away like you're water skiing. Take out the slack. Just gently lean away. This is a great way to take out tension in his lower back, his legs, his spine. It starts to stretch what we call the dural tube. It's the connective tissue around the brain and spinal cord. So it'll start to gently open all these joints just by leaning away from the heels. And if he's, any of these things, if he's like, contracts against it a lot, don't force, just back off or go with. If he starts to pull his legs in, go in with his legs. There actually may be a very helpful therapeutic technique that comes out of that. We call that unwinding sometimes. I mean, it might be his mind resisting, but also sometimes when we get past our conscious mind, and he's kind of in this dreamy state a lot, it sounds like when you wake up in the morning, you're stretching around. It's your body wisdom that's taking you in these positions, and so work with his body wisdom. If he's resisting, go with it and just support it. Don't try to make it go somewhere you think it should go. Ask his body to tell you where it needs to go and which way you can help it to soften the most. Unconsciously, non-verbally ask these questions, and it will give you answers. Trust it. Trust what you feel. Trust your body wisdom, and trust his body wisdom to communicate with yours. The more relaxed you are, the more effective you're going to be. All right, brother. I love you. Hope you're doing well, and I hope this helps.